Welcome to the Lab to Table podcast, brought to you by Mariu Nutrisciences. In a world where the food industry is constantly evolving, we're here to help you break down the complexities. Join us as we sit down with some of the industry's leading experts to tackle critical food safety updates, decode shifting consumer trends, and deliver the actionable insights you need to stay ahead.
Thanks for tuning in to this episode of Lab to Table. I'm Mark Mantala with Mariu Nutrisciences. Today we're joined by two of our experts, Chris Newton and Will Melnichenko. They'll be talking about industry trends, everything from the MAHA movement to GLP-1s. Chris?
Hi, I'm Chris Newton. I am the Business Development Manager for Expert Partners of Mariu Nutrisciences. I've been in the industry for going on 15 years. I started out as a microbiologist in a lab. I've moved on to sales consulting, and here I am with business development again.
Hi, I'm Will Melnichenko. I'm the Global Business Development Director of Digital and Industry Segments at Mariu Nutrisciences. I joined Mariu Nutrisciences with over 16 years in industry. I have come from both operations, laboratory diagnostic kit sales, as well as third-party lab testing.
All right, well, I'm going to start with our first question. It's going to be like defining the movement, if you will. So let's start at a high level. When we hear Make America Healthy Again, in the context of the food industry, what are we really actually talking about? Is this just about banning red dye 40, or is it a bigger philosophical shift?
It's a great question, Chris. We keep hearing Make America Healthy Again. It's been in the news. It's been at trade shows. We're seeing it coming from consumers and industry. Really, when we're talking about Make America Healthy Again in a food context, it's really a push against chronic disease, a removal of ultra-processed foods from consumers and specific additives. So you're right on the money there with dyes, seed oils, and sugars. I think this is a pertinent topic to talk about in the new year. We're definitely seeing a shift across the industry based on this regulatory and formulation consequences for the industry. Based on this regulation. So I hope that I helped to define kind of what it is, but it's really a push to a push towards clean label, if you will, in the food industry.
Great, thanks. My next question. If I'm a product developer looking at my ingredient deck right now, what should make me nervous? Are there specific additives or chemicals that are currently in the crosshairs?
Yeah, so right now, really what we're seeing in terms of specific ingredients, red dye 40, we've seen that was kind of a push that started in California as an additive ban, yellow 5, titanium dioxide. So when we think about, the MAHA movement and kind of where we are, many of the roots of the movement can kind of be traced back to a lot of activities that came out of California to start. But it's not just California anymore, which again started with Prop 65. It's really becoming a national conversation. So, we're seeing customers increasingly seeking products that they view as clean label. And when we talk about a clean label product, that can be relatively hard to define as well. So, really what consumers are looking for is a limited number of ingredients on their product label, as well as ingredients that they recognize as safe and wholesome for their families. So, really the talking point here is, ultra processed is becoming a dirty word. Consumers are being taught to look for these shorter ingredient lists, and that's also being actively marketed towards consumers as better for them or more healthful for them.
Great, great. And that kind of leads me into the next question about health and Make America Healthy Again, and then a clean label. That kind of elicits healthy, thinking of clean. Something interesting is the Ozempic effect, the GLP-1s, the weight loss drugs. Do you see them impacting the market? And I guess, how does the rise of this Ozempic type product or drug connects to the push for healthier foods, in your opinion?
Yeah, that's a great question. When we think about kind of the Ozempic effect on the food market, and we kind of pan back out before Ozempic was even on the market, again, consumers are really pushing for healthier alternatives to most snack foods that you'd see on the shelf. So as much as I personally love salt and vinegar chips, maybe I know I should make a better choice for myself and pick something that's higher in protein, higher in fiber. Again, looking for that clean label. Maybe I, want to search for something that's cooked in a particular kind of oil. Maybe I have my own preferences on what I consider a healthful oil or a non-healthful oil. I know there's been a lot of talk about beef tallow, but personally, I'm a vegetarian, so I wouldn't look for beef tallow. So I think it's really subjective for each consumer. But, when we look at GLP-1s and kind of how they actually work, right? So GLP-1s is a hormone that actually helps reduce consumers' appetite for food. So that's what actually drives the weight loss, I guess, in layman's terms. And I'm not a scientist, so I'm speaking from my understanding of the drugs. But when we look at how that affects the food market as a whole, again, consumers, they're eating less food, so they're going to be snacking less. So when they do choose to snack, they're going to be looking for foods that, again, are high in fiber, high in protein, preferably lower sodium content. These are foods that are going to help them in their weight loss journey and their active lifestyle kind of going forward once they're on these GLP-1s. So for the industry, this has been a seismic change as well. So, as much as we all love our corn chips that are flavored and different products that we typically turn to satiate our crunchy, salty cravings, for example, many consumers are looking for products that might be, we've seen like the naked chips come out with no seasoning or, no coloring added to the seasoning. We've seen new products, I'll stick on chips, like that have protein added to them. So they actually have some protein powder added to the chips, or they're imbibed with different protein alternatives, plant-based proteins. So, they have a kind of what we would consider a perceived halo in the market to entice consumers to choose those products over the traditionally more processed or what they may view as more processed products.
Great, thank you. And, that does sound like the consumers, as usual, are driving the market, but driving it towards healthier options, the clean labels, healthier profiles. But we all know you can't just rip out sugar or preservatives or dyes without consequences to the recipe. What happens to the product when you start reformulating to meet these new standards? I imagine taste and texture change, maybe shelf life changes. What are your thoughts?
Yep, you're exactly right. So, I mean, this has been a huge area of focus for our experts here at Mary NutraSciences, for our customers. So, when we're looking at reformulation in products, again, it's, as you pointed out, it's driven by consumer preference. And if we reformulate and deliver a product that doesn't meet those consumer preferences or simply isn't as appealing to those customers, we're going to have a reduction in sales. And that's really counterintuitive from what we're trying to do in terms of selling food. So, as companies look to reformulate, they can look to leverage external expertise if they have a small team. Again, speaking from the side of Mary NutraSciences, leveraging consumer sensory research. So understanding, again, consumer preference testing, understanding how this product might taste over time, how acceptable it might be, especially if it's products that are more marketed towards a particular segment of the population. It's really important to make sure that those products still land successfully with those populations. In addition to that, when we reformulate and we look to make things clean label, we might swap out different additives that we had put into the product before. So different inhibitory agents that might have helped extend that shelf life. Again, like how does that affect the food safety? So can it stay on the shelf as long as it once had under this new reformulation? Is it still performing effectively? Is the product staying crunchy? If it's a chip, right? People want that crunch. Is it still crunchy after, 1 or 2 months on the shelf, or has something in the reformulation reduced its ability to stay crunchy? So there's a lot of different angles that food producers need to be aware of when they reformulate, because small changes can actually have pretty large implications on the product and the product's acceptability to consumers.
That's very interesting. Like you said, yes, a little change can make a big difference in the crunch, for instance, of a chip. So we're stay on the label conversation. Let's be a little bit transparent here, where with a cleaner label, a reformulation, obviously the ingredient list is going to change, possibly the nutritional facts. But I'm seeing that, or we're seeing actually, there's a push for front of pack warnings. How is this changing the way companies have to market their products on the shelf, do you think?
Yeah, so this is fairly new, in the scene of things for food producers to have to think about. So that front of package warning, I'm not sure how far along in the process the regulation is on some of these. I know state to state, we're kind of seeing a complex web of regulations being rolled out, some states being more aggressive than others. some states prioritizing certain market segments that might be more economically beneficial to that state in particular, whether that be meat production or cereal grain production. So it's quite interesting. At the end of the day, I hope that this legislation doesn't aid in confusion among consumers. We definitely don't want consumers to view food as being intentionally not good for them or bad for them. I think that would completely miss the point of what most food companies are here to do, or all food companies are here to do, which is to, make as much healthy and nutritious food for consumers as they can. So it's quite interesting to kind of see this roll out.
Do you think that there's a risk potentially with the labeling and the front of package warnings and such of making labels truthful enough or maybe health washing them?
Yeah, I mean, I think the legislation is seeking to inform consumers around overall product risk or category risk. So, if you're eating or consuming a lot of these products, like what could be the ramifications or outcomes of doing that. So I can see it kind of from both sides, but as a food producer, if you're making a product that's been generally accepted in the marketplace and has high consumption rates, like to put a label on it that says this product might be risky to consume, I can definitely see how that seems rather outrageous for a food producer. I mean, I think that things that often get kind of fall through the cracks are really where I think most food producers should focus here. So when we talk about reformulation and packaging changes, it doesn't just pertain to the packaging itself. So, the website where you have your product listed needs to have those changes incorporated into it. Anywhere that you've published, what's in the label, nutritional values, like that all needs to get updated. I can't wait to see what MyFitnessPal looks like after this legislation gets full effect, right? So, like, how does this change the caloric intake, the macros in the product, things like that. So, I think that's really where not only food companies, but also consumers should focus on. So, you could have a product that's reformulated, but it might end up being less nutritionally valuable to you potentially, depending on what is removed from the product. So to me, I think really focusing on, that label and understanding like how that impacts, what your daily caloric intake is, as well as the different macronutrients that might be in that product, I think is the most important.
Great, thanks. And that's a great point that you bring up about all the different resources that a nutrition facts might be listed on, or the ingredients themselves. The companies have to be really vigilant about where these resources are and make sure that they're updating them. So great point there. And then that also brings me to my next question. We've talked a lot about the labels, but what about those ingredients or finished products that are coming in from overseas? I imagine, as you might as well, there might be a stricter focus on, or with the stricter focus on American health. Do we expect tighter testing on those imports?
I would definitely say so. I mean, I think, as the population in the United States and abroad continues to become more diverse, more and more consumers are seeking exotic inclusions. And, these inclusions might be coming from faraway places or places that, are outside of our purview in terms of where we actually have boots on the ground, so to speak, from the food company's perspective. So where we actually have routine operations, or where we have the ability to do food safety audits or gap assessments. So I think that is going to be key for many food manufacturers, is to really understand their overall risk profile for these inclusions and for these products. So ultimately, I believe the responsibility falls on the importer in terms of, the food safety aspects. You definitely never want to end up on that FDA detention list if you're trying to import a shipload of product in the United States, and, the FDA flags it as being from a producer that has had known risk or known failures. So being very cognizant of that, and really understanding what what's in your toolkit, and when you're looking across your network, if you're looking to launch a new product or bring a new product to market, where are you sourcing those ingredients from, of not only where geographically, but also whom is manufacturing those products in that geography, and really understanding what their risk profile is. So again, shameless plug. I mean, Mary NutraSciences can definitely help with that. We do have a foreign supplier verification program available to all of our customers. So if you have foreign suppliers and you need help vetting them or understanding what risk that might introduce into your supply chain, we can definitely help with that. But we're not the only ones. We're not the only game in town. There's definitely other areas you can look. There's also a lot of software solutions that can help with that if you don't want to fully invest in, remote audits or a full foreign supplier verification program. So lots of different tools available to food producers, but I think the most important thing is just to think about it in a holistic way, especially if it's an area of the world that you've never done business in. Like, who can you lean on, or who can you ask? Ask your competitors, ask your frenemies, like who they've used to help them navigate those risks, I think is really imperative.
Yeah, asking questions is definitely imperative. I just feel like with all the changes and kind of happening at breakneck speed, it can be overwhelming, especially for the people managing the ingredients, the supply chain, the QA team. Typically, the QA team's already stretched pretty thin. And with all this overwhelming change that is coming through, what do you think the single most important step, like where's a good point of starting? Would maybe a gap assessment be a good point to start?
Yeah, I definitely think a gap assessment is a great place to start because it really helps you understand again the overall risk. Because your goal as a food producer is to bring healthy, nutritious, and safe food to market for your consumers. You don't want to risk damaging your brand or your reputation based on a small mistake, as you know, in the food industry can quickly snowball if something's overlooked. So a gap assessment's a great place to start. Again, kind of understanding, do you have an approved vendor list? Have you sourced from this supplier or this country before, this particular ingredient? Understanding in that ingredient class, is there a particular risk that you should be aware of? Again, there are software solutions that you can use to help you understand that risk before you even get started. There's also, a lot of software available for reformulation. So that software can help you kind of determine, if there is an ingredient that you are looking at, are there alternatives that might be a little lower risk or maybe easier to manage, or that you can even source domestically versus going overseas? Because at least, more often than not, if you're sourcing domestically within the US, we know that we're all operating under the same FDA framework. So it's a pretty safe bet that those products are going to be, you can trust your supplier's certificate of analysis, for example, when you're bringing that product in. So you have quite a bit at the ready to help. But really, kind of the bench concept. So having an external bench of experts who can look at your regulations objectively without any internal bias and help kind of steer your team. So we know, these products can be kind of imagined by marketing or R&D groups, but then when we actually look to commercialize them, it can be a much bigger challenge. So, lean on your laboratory services provider, lean on any of your food safety experts that you have access to help you formulate a plan. Even maybe before you do a gap assessment, help you formulate a plan and kind of determine, with what product or what category of ingredient might be the highest risk, and then kind of work your way down to the lowest risk until you have a complete picture of, what this new product or new commercialization product means for not only your supply chain, but also for your production facilities and your frontline workers in those plants. I've talked quite a bit about gap assessments, and I was wondering if you could inform our audience what a gap assessment is. I know that we probably hear this a lot in the food industry, and I just wanted to have an opportunity for you to kind of break it down for us, what it is, for those who may not be aware.
I know, yeah, you're right. Some people may not fully understand what the gap assessment is. What a gap assessment is we will look at a company's food safety program, or maybe a piece of the food safety program, such as maybe their environmental monitoring program. But essentially, we look at the overall food safety program. We see how the processes are going. We see if they have all the SOPs aligned, if they're keeping track of all the monitoring documentation, and look inside and out at their food safety programs to make sure they are doing everything that's required by regulation. And sometimes we find gaps. Maybe they're not monitoring a temperature as many times as they should, for instance. And when we identify those gaps, we provide a nice report of gaps that we find, and we offer some suggestions on how to fix or fill those gaps. It's basically an overhaul review of the food safety process and programs of a company's procedures. And then we help not only identify, because when you're doing the same thing over and over, the people who are doing that every day kind of get blind to the gaps. So we get our consultants in there as a new, fresh set of eyes, and they can see them a little bit more readily. And then again, we discuss and suggest some changes on how to fix those gaps.
Great. Thanks, Chris. And then how does, I guess, what's the difference between a gap assessment and my food safety plan?
So the food safety plan is your plan that you have. The gap assessment reviews that and sees if there are any gaps. We want to make sure that you are following your food safety plan. We want to make sure your food safety plan is written properly to meet the regulations that your company is governed by. So the food safety plan is the overall plan for the company, where the gap assessment is a review of that plan to make sure everything is included that is required.
Thanks for breaking that out, Chris. So I can see, just based on the overview that you gave us of both the food safety plan and a gap assessment, how if I am a producer who is, potentially reformulating or even launching a new product to align with the Make America Healthy Again, how that might really impact both of those items, right? So like if I have a food safety plan, already written and in use as I should, right, to make sure I'm meeting regulation in the US, if I'm looking to commercialize a new product and I'm bringing in new suppliers, these could definitely be blind spots, could be uncovered in a gap assessment.
Definitely. We'll help you take a look at your suppliers and their food safety plans. Even look at the ingredients themselves and break down what the hazards are of those specific ingredients.
Yeah, I'm just thinking about all of the products that will have, red dye 40 removed out of them. They may look gray, or maybe they're not going to be looking very appetizing. So, bringing in, a new colorant, especially a new natural colorant, it might have some different flavor profiles and things like that. So not only from the food safety perspective, but also potentially, again, as we talked about earlier, like a sensory perspective, looking to lean on those external experts that you may not have in-house would be very important.
When I think of new ingredients, my mind goes straight to allergen threats or risks. We could help determine what, if at all, there is a new allergen with a new ingredient coming into the plant that then the facility would have to plan for.
Yeah, it's a good call out. I definitely remember back from my days in operations, running trials, and that was always a fun one. We always made sure we ran those trials prior to our routine sanitation and maintenance program, because you never knew what was going to get thrown at you, like how clean you had to make that line after those product trials ran through, because you just never knew what was going to be in them. So it's a good call out there for your operational folks too. I think it's good to make them aware of any new products you're looking at, and also helping to determine what plants you might run these trials in if you don't have a dedicated plant for trials.
Yeah, it could create a snowball effect. If there's an allergen, then you need to make sure your sanitation program is working well. You need to make sure the environmental monitoring program is also detecting a new allergen if it is present or not. So it's one program. A failure or gap can affect the entire program, or at least several other smaller programs within the food safety program.
Yeah, definitely. I'm just trying to think anecdotally, like, we speak to many different customers, facing many different challenges across the whole landscape of food manufacturing, folks that are not only making finished product, but also folks that are making things that will ultimately go into finished product. And I think these are all really important points, to take into consideration, not only if you're reformulating, but also just in general, right? Like how often you're visiting that food safety plan, how often you're examining what's being run in your plant. And, last point too is, our frontline workers. So, we've seen in the industry over the pandemic and after, a lot of our most seasoned professionals and frontline workers actually, retiring, they're aging out. So, keeping up that education and keeping up the vigilance on food safety with our younger employees and frontline workers, I think is a huge area to focus on as well, regardless, again, if you're reformulating or launching a new product, but just in general, doing that kind of that gut check for your plant and your employees to make sure that they understand all of the different aspects of your food safety plan.